Lifecome Care Limited has been operating in the UK for a number of years and promotes itself as an organisation that believes in family values, integrity, reliability and honesty. Although the privately owned Gibraltar-based company will offer a bespoke package, it's been designed with the service user in mind and will include support services such as personal grooming, helping with meals and chores, medication and supporting exercise programmes. More generally, it will promote good health and social well-being. The Minister for Health and Care confirmed she was not involved in the procurement process.
So the way that the process works is that the procurement set up a board. There's an internal board and then there's an external board. And those boards are the ones that ask all these queries. So they're the ones that know who the company is, they're the ones that, and they are the people that do all the due diligence. I and any minister maintain themselves away from this process so that we're just given the information on what the best tender has been once it's all decided.
The UK Quality Care Commission has rated the London service as good in its last 2 inspections over the past 5 years. It says the company is well led and that people are supported by trained staff. So how would that translate locally?
The services that we had weren't contracted for. So we were providing services on a very ad hoc basis because this has grown organically. So the great thing about this is that we now have a contract that we can hold people to. The contract has the hourly rate, for example. The contract has the services that we expect from the service provider. So we now have a document that we can go back to and say, this is what we're expecting, this is what we contracted for, this is what we need you to do. Which means that the day that we are ready to audit all the services, because I've explained this numerous times, what we'd like to do is have in place all the contracts as the foundation blocks, which set out the standards that we're expecting. So that then once we have those standards in place, we can then go out and audit.
In Gibraltar, current care and support workers will be absorbed by the new service provider under a new contract. The question is, at a cost to the taxpayer of £3.8 million, how will the care agency ensure that standards are not only met but kept?
So what we've tried to do is we try to listen to those complaints, so we try to remedy them. Continuity of care is a constant complaint that we get, and the other constant complaint is that the carer doesn't turn up at the house of the service user. So what this company does is that they are able to electronically monitor their workforce so that they know where they are at every point in time, so that they know exactly when someone's not going to go to work so that they can replace that person with another individual. So we are hoping that this service delivers a better standard of service for the user. We are hopeful that this service actually addresses some of the issues that have constantly been raised with us. So what we're doing is try to listen to the people and try to improve the service that each and every user gets, which is what this is all about. You know, we want to make sure that every user gets the best possible value from every pound that we spend on them.
Lifecome Care pledges the highest quality service and it provides the care agency with a modern framework which will enable it to really uphold standards, which ultimately is what every service user and their families want and deserve.